I love orthopedics. It's very rewarding. I can get them back to their sports, to what they like to do. I concentrate more on hands because I feel like I can do everything that's related to the hands. Repairing tendons, treat fractures, treat arthritis. Basically anything that involves a hand, I can do. Everybody takes it for granted the use of their hands until something bad happens. With the arthritis, their activities are very severely affected. They cannot grasp large objects. They cannot turn a doorknob, or they have difficulties opening a jar, and they really can't squeeze their fingers tight because that really hurts when they load from the very tip of the thumb. So after the surgery, all that pain should be gone. So their hand function is much improved. The very first case that I did today was for CMC arthritis, which is arthritis at the base of the thumb. And that is a very common type of arthritis that people get. Usually happens in patients in their 40s, 50s, 60s and above. And it is the most common of arthritis that causes pain, and that's one of the reasons why they come to me to seek for treatment. For arthritis, there's definitely a genetic component to it. There's also occupation or vocation related issues. So, but the truth is, everybody uses their thumb all day long, no matter what they do. So it is a very common because everybody uses their thumbs during activities. It's a lot of delicate work, and I enjoy that aspect too. Trying to restore the normal anatomy, by looking at it under a microscope, and yeah, that's the part I really enjoy. A lot of times the patient tells me, that they're ready to do something else. Usually, same thing as the patient that we just did this morning. She had multiple steroid injections. She was wearing a brace, and she has been suffering from pain for years because of the arthritis at the base of the thumb. And steroids, the very first shot helped her for a long time. And the more shots you get, the help that you get from the shots becomes less. It becomes diminishing in terms of the symptom relief you get. So at that point, patients are ready to do something else. The recovery is a little involved. Usually during the first 6 weeks, there's not much movement. Their thumb is immobilized to let everything mature. And after that, they can start doing things. And I would say a full recovery usually takes about 3 months, but by about 2 months, their function will be much better. They'll be able to start using their hands without pain. You really don't know how debilitated you are, even from the minor injury to the hands, until it happens to you. And even a small injury to the small finger in their non-dominant hand could have a really bad effect, and it could be very disabling. And that's something that I hear all the time when patients come in, and after I treat them with surgery, injections, whatever that might be, they're very grateful because their function is back and their livelihood is back because they have full function of their hands again. And I would say those are the best things I heard from the patients. They thank me for having their hand back, and that's what's the most gratifying of my job.